Restless leg syndrome (RLS) is a neurological disorder. Look at this picture, shows that restless leg during sleep. Sleep studies. Look at this for diagnosis. A detail going on. Introduction. Restless leg syndrome, also known as Wills-Ekbom disease, is a neurological disorder characterized by an uncontrollable urge to move the legs, often accompanied by unpleasant sensations. It primarily occurs during rest or inactivity and is temporarily relieved by movement. The condition can significantly impact quality of life by disrupting sleep and delayed activities. Etymology. The term restless leg syndrome was first described by Swedish neurologist Carl Axel Ekbom in 1945. It is also known as Wills-Ekbom disease, honoring Sir Thomas Wills, who documented similar symptoms in the 17th century. The name reflects the primary symptom, an uncontrollable urge to move the legs, especially during rest. A definition. Restless leg syndrome is defined as a sensor-motor disorder characterized by an irresistible urge to move the leg, typically due to uncomfortable sensations, predominantly during periods of rest or inactivity, and elevated by movement. Types. 1. Primary RLS. No identifiable underlying cause, often has a genetic predisposition. 2. Secondary RLS, associated with other medical conditions or factors such as pregnancy, iron deficiency, renal failure, or neuropathy. Causes. Primary RLS, believed to be linked to dysfunction in brain pathways involving dopamine. Secondary RLS common causes include 1. Iron deficiency anemia, 2. Chronic kidney disease, 3. Pregnancy especially in the third trimester, 4. Peripheral neuropathy, 5. Certain medications, example antihistamines, antidepressants, and antipsychotics. 6. Lifestyle factors, example alcohol, caffeine, nicotine. Risk factors. 1. Age, more common in middle age and older adults. 2. Genetics, family history increases risk. 3. Gender, more common in women. 4. Chronic conditions, diabetes, renal failure, and Parkinson's disease. 5. Pregnancy, especially during the third trimester. 6. Lifestyle, sedentary lifestyle, stress, and poor sleep hygiene. Complications. 1. Sleep disturbances, insomnia due to difficulty falling or staying asleep. 2. Daytime fatigue resulting from poor quality sleep. 3. Mood disorders, anxiety and depression. 4. Reduced quality of life due to chronic discomfort and interrupted sleep. 5. Cardiovascular issues, increased risk due to disrupted sleep patterns. Pathophysiology. Restless leg syndrome is a neurological disorder characterized by an uncontrollable urge to move the legs, typically accompanied by uncomfortable sensations. It pathophysiological involves several interconnected mechanisms. Below is a step-by-step explanation of the process. 1. Genetic predisposition. Genetic factors. 2. Dysregulation of dopaminergic pathways. Dopamine role. 3. Iron deficiency in brain. Iron's role. 4. Abnormal spinal and peripheral nerve processing. 5. Circadian rhythm and symptom exacerbation. 6. Peripheral and central sensory abnormalities. 7. Sleep disturbance. The urge to move the leg and associated discomfort disrupt sleep patterns leading to insomnia. Sleep deprivation further exacerbates dopamine dysfunction and sensory hypersensitivity, creating a vicious cycle. 8. Inflammatory and metabolic factors. Chronic inflammation and metabolic symptoms, example obesity, diabetics, are linked to increased RLS prevalence. Inflammation may worsen microvascular health and iron transport, aggravating symptoms. Signs and symptoms. 1. Primary symptoms. Urge to move the legs, often accompanied by tickling, craving, or burning sensations. Symptoms worsen during rest or inactivity. Symptoms are primarily or completely relieved by movement. Symptoms occur or worsen in the evening or at night. 2. Associated symptoms. Sleep disturbances, periodic lymph movements during sleep, PLMS, daytime fatigue and reduced concentration. Diagnosis. 1. Clinical criteria based on the International Restless Legs Syndrome Study Groups criteria. 2. History and physical examination. Detailed patient history, family history of RLS. 3. Laboratory tests. Serum, ferritin and iron levels, renal function test, thyroid function test. 4. Sleep studies, polysomnography to elevate sleep disturbances and periodic limb movements. Nursing diagnosis. 1. Disturbed sleep pattern related to discomfort in the legs. 2. Active intolerance due to fatigue and sleep disruption. 3. Ineffective coping related to chronic discomfort and frustration. 4. Risk for impaired skin integrity due to excessive leg movement. 5. Impaired social interactions related to the impact on daily life and mood. Management. Medical management. 1. Pharmacological treatment. Dopaminergic agents. Iron supplements if iron deficiency is identified. Anticonvulsants, gabapentin, pregabalin are for sensory symptoms. Benzodiazepines, clonazepam for sleep disturbances. Opioids for severe refractory cases. To non-pharmacological measures, regular exercise, maintaining a consistent sleep schedule, avoiding caffeine, alcohol, nicotine. Nursing management. 1. Assessment. Monitor severity of symptoms and triggers. Evaluate sleep patterns and quality of life. 2. Interventions. Encourage stretching exercises before bed. Educate on dietary modifications such as increasing iron rich foods. Promote relaxation techniques like yoga or meditation. Assist in creating conducive sleep environment. Provide emotional support to address anxiety and frustration. Treatment options. 1. Lifestyle modifications, regular physical activity, stress management, adequate hydration and balanced diet. 2. Medications tailored to the severity and underlying causes. 3. Physical therapies, massage, heat or cold applications. 4. Cognitive behavioral therapy, CBT, for associated mood disorders. 5. Alternative therapies, acupuncture, aromatherapy. Psychosocial medicine. 1. Patient education, provide comprehensive information about RLS and coping strategies. 2. Support groups, encourage joining support groups to share experiences and reduce isolation. 3. Stress management. Teach relaxation techniques such as deep breathing or mindfulness. 4. Cognitive behavioral therapy CBT. Address negative thoughts, patterns and improve coping mechanisms. 5. Family counseling. Involve family members to foster understanding and support. Prevention. 1. Address iron deficiency through diet and supplements to avoid RLS triggers like caffeine, alcohol, and nicotine. 3. Maintain a regular sleep schedule. 4. Engage in moderate physical activity. 5. Manage chronic conditions effectively. In conclusion, restless leg syndrome is a manageable condition with appropriate medical, nursing, and psychosocial interventions. Early diagnosis and personalized care plans can significantly improve quality of life, minimize complications, and enhance overall well being. Multidisciplinary collaboration and patient education are key to effective management and prevention. Thank you. Have a nice day.